Yes, hello everyone. Hope this one finds you well. I'm Dr. Helen Nerima, currently working at Jaramogi Odinga Teaching and Referral. I work with the Research Institute in the Balance Study as a research assistant. Today we are going to discuss about cancer. So I'm just going to give a brief talk concerning that. So our protocol will follow the definition of cancer, etiology, cause, common types of cancer is in Kenya, and then we will go through a few cancers like cancers of the breast, cervix, prostate, and prevention. So I'm going to start. We will briefly discuss what is cancer. Cancer is a condition whereby there are some body cells which grows uncontrollably and spread to other parts of the body. Today we've decided to discuss about cancer because of the morbidity and mortality that it causes to the people in our country and all nations. Concerning the etiology, this is in simple terms what really happens until cancer comes in. This is whereby the normally programmed cell death goes off and there is change in DNA, and then the cells does not die off. So this makes some cells just continue growing without any stop. So it makes someone to have cancer. And then we are going to discuss about the causes. There are no specific causes of cancer, but we have predisposing factors. So the predisposing factors that we have tobacco use. Tobacco has components which may cause these changes in DNA, which may lead to uncontrolled cell growth. And then we have alcohol consumption. Alcohol has been known to increase chances of someone getting cancer. Air pollution, like in areas where we have industries or where there are a lot of chemicals, at times people tend to get cancers. And then there are cancers which are familial, like breast cancer, because you realize some of the people in a certain family, they may have that predisposition of getting breast cancer. And then inactivity, because we are usually advised most of the time to be active in our daily activities, to do exercise. It's not advisable just to someone to sit unless otherwise. Another predisposing factor is age. You will find most of the cancer in older population than the younger population. And then another predisposing factor is viral infection, like we have the HPV virus, which usually occurs in a patient who have cancer of the cervix. And then there is exposure to certain chemicals. Other predisposing factors still include radiation, ultraviolet radiations. So those are the common predisposing factors and many others. Which are the common type of cancers in Kenya? We have breast cancer, we have cervical cancer, prostate cancer, cancer of the esophagus, we have non-Hodgkin's lymphomas, we have colorectal carcinomas. Those are one of the most common cancers in Kenya. We also have bone cancers, skin cancers. So for that, we are just briefly going to discuss signs and symptoms of some cancers which are common in our community. So number one, I'm going to start with the cancer of the breast. The signs and symptoms which will be present. There may be a breast lump, or there may be swelling on the breast region. There may be tenderness at the breast region or inflammation, that means just swelling. Or at times other patients may present with bloody discharge from the nipples. Some patients will present with orange peel appearance on their breasts. Apart from that, some patients will present with weight loss, signs of anemia like lethargy, dizziness, and fatigue. And some of the patients will present with the signs of metastasis. That means the cancer has come from the breast to other parts of the body. Some people may have difficulty breathing if that cancer has metastasized to the lungs. Some patients may present with the signs of abdominal distension, pain if there is metastasis to the abdomen, that is the region around the stomach. So another cancer which I'll briefly discuss is cancer of the cervix, whereby the affected woman will present with vaginal bleeding, painful coitus, that is painful sex, foul smelling vaginal discharge, weight loss, lethargy. At times some of them may have fatigue. For the CS cervix, it's one of the common cervix which has really affected a lot of people. I'll briefly discuss another cancer, which is cancer of the prostate. This type of cancer occurs mostly in older population, in men who are mostly above 50 years. This is whereby the patient may present with a history of difficulty in passing urine, or the urine may have blood in it, and there may be urine retention whereby the patient is not able to pass urine. And at the same time, the patient may present with weight loss, lethargy, and any other signs. And if there is spread of that to a certain part of the body, that means the patient will have symptoms related to the affected part. So we are going to talk about prevention. I'll just briefly talk about prevention. So prevention, I'll start with the one for cancer of the breast. Concerning prevention of cancer of breast, each and every woman is advised to visit health facility so that she can be examined by the healthcare workers, especially if she notes any changes. And then we have breast self-examination, whereby it's advised for each and every woman to know how to examine her breast and to be able to note if there are any changes. And then another one is to be careful about the family history, in case there is any predisposition, whereby maybe we have family history of breast cancer. The woman should visit health facility so that she can be advised. I'll talk about prevention of cancer of cervix. This is whereby each and every woman is advised to visit health facility so that speculum examination can be done, so that any changes on the cervix, if noted, action should be taken. And then another one, if there are any signs and symptoms that we've discussed, like vaginal discharge which is recurrent, foul smelling, or painful coitus, a woman should visit the hospital. And then to avoid early coitus, that is early sex for the young girls. And then it is also advised for women to avoid multiple sex partners, to avoid the transmission of human papilloma virus from one person to the other, which is also a risk factor of cancer of the cervix. I'll also talk about prevention of the cancer of prostate. This is whereby every male, especially men aged 40 years and above, are advised to go to the hospital so that their prostate-specific antigen levels should be known. If it is high, they should follow up and also do the imaging. Also advised to go to the hospital immediately they see signs of difficulty in passing urine, bloody urine, or if they are unable to pass urine. And also other tests which may be helpful, it is doing ultrasound, whereby in case there is enlarged prostate, it will be noted and the patient will visit the doctor so that he can be helped. Thank you so much for being attentive. Thank you so much. More other topics will be discussed in our next lesson. Thank you.